The report also highlights the response to COVID-19 cases that emerged in migrant worker dormitories. It finds that insufficient initial precautions and workers confined to their dorms were some of the issues which could have been handled better. Sherry Look reports.
When the first dormitory case was detected on 8 February 2020, the initial response was to follow procedures that were put in place following the SARS crisis. But with more clusters emerging in dormitories, the situation soon spiraled into what the government now calls a crisis within a crisis. A lack of integrated access to migrant workers' health records and limited testing capabilities at the time compounded issues.
When we are dealing with healthcare related issue, I think that if the health ministry or if MOM can pass information to dorm operators and let us know exactly what is required of us, I think dorm operators will be able to turn around really quickly.
While the outbreak was eventually contained, an abundance of caution followed, including extending restrictions. But the COVID-19 review notes that these took a toll on workers' well-being. So looking ahead, the government wants to better prepare for the next crisis. For instance, the Manpower Ministry has established a new primary healthcare system for migrant workers. At clinics like this, they can get treated for acute and chronic illnesses for just $5.
A lot of them are very happy that they, first of all, have more access now to medical care, and that is a lot more affordable. And of course, the 24/7 telemedicine makes it, so much more accessible.
The clinic sees as many as 180 workers each day. Another takeaway was the need to maintain more reliable information on the migrant community, even during times of normalcy. However, one advocacy group cautions against constant surveillance.
I don't think it does justice to the mental health and the freedoms of the migrant workers who are so essential to Singapore. It may be necessary to have a kind of a system where at short notice, when a new crisis appears, we need to know where people are staying and how they can be reached.
And so, Mr. Al suggests putting in place a data mobilization system instead.